So I'm sure you've been there, right? At the doctor's office, and they ask you on a scale of 1 to 10, how bad is your pain? It seems like such a simple question, but behind that question is this whole complex, really structured system for understanding one of the most personal things any of us can ever feel. Okay, so let's get into it. In this explainer, we are going to pull back the curtain on how medical professionals go from that simple 1 to 10 scale to getting a full picture of what someone's going through. We're going to break down the official playbook for assessing pain. So here's our game plan. First, we'll nail down what pain actually is, according to the experts. Then we'll jump into the playbook itself, how doctors classify pain by where it is, how long it's been there, and how bad it feels. After that, we'll dig into the root causes, and finally, we'll see how it all clicks together. All right, so let's kick things off with the biggest question of all. What exactly is pain? The official definition is really telling. Pain is an unpleasant sensory and emotional experience. See, it's not just physical, it's tied up in our feelings, our memories, our emotions. But the most powerful part? It's that last bit. It exists whenever the person says it does. Basically, if you feel it, it's real. Period. Your pain is always valid. And because your pain is always real, this just makes sense, right? Every single patient has a fundamental right to have their pain taken seriously, to be screened, assessed, and managed properly. And that's exactly why having a system, a playbook, is so incredibly important. Okay, so if pain is so personal and subjective, how in the world do you measure it? How do you even start to treat it? Well, you need a system. You need a playbook to help sort it all out. And this whole playbook really just boils down to asking a few key questions to build a complete picture of what's going on. We're going to start by breaking down the first three: where the pain is, how long it's been around, and how bad it feels. These are kind of the big three to start with. Where does it hurt? How long has it been hurting? And on that scale, just how bad is it? So first up is location. This one's pretty straightforward. Is it a headache? Is it back pain? Chest pain? Figuring out the where is always the first step on the map to figuring out the why. But where can actually get a little tricky. Take a look at these two ideas. Radiating pain is when it starts in one spot and travels. Think about a pinched nerve in your back that sends a shooting pain all the way down your leg. But referred pain is even weirder. That's when you feel pain somewhere totally different from the actual source, like how a problem with your heart can show up as pain in your left arm. Okay, let's move on to the when. This is all about duration. The general rule of thumb is a dividing line around 3 to 6 months. If your pain lasts less than that, it's called acute. It's your body's alarm system going off. But when that alarm just won't shut off and it keeps going for more than 3 to 6 months, it crosses over into being chronic pain. And even chronic pain isn't just one thing. It gets broken down further. You've got non-malignant pain, like from arthritis. Then there's malignant pain, which is tied to cancer. And you can even have something called acute on chronic pain, which is like a sudden flare-up that happens on top of a long-term issue. And finally, we get to the how bad. And yep, here's that famous 1 to 10 scale we all know. But it's not just a random number. Clinicians actually group these ratings to make them more useful. So anything from a 1 to a 4 is considered mild. A 5 or a 6, that's moderate. And if you say it's a 7 or higher, that's classified as severe pain that probably needs attention right away. So we have where, when, and how bad. But now we get to the real detective work, maybe the most important question of all. Why is it happening? This is the fourth classification, known as etiology, or, the root cause. The most common cause is something called nociceptive pain. The easiest way to think about this is it's your body's normal, healthy alarm system. When you touch a hot stove or sprain your ankle, these tiny little danger detectors in your nerves fire off a signal to your brain that says, hey, something's wrong here. And it usually feels like an aching or throbbing. And this kind of pain, this damage alarm pain, well, it comes in two main flavors, and it all depends on where that damage is. So first, you've got somatic pain. This is pain from your body's outer shell, basically. Your skin, muscles, bones, joints. Think of a paper cut, a pulled muscle, a broken bone. It's usually pretty easy to point to exactly where it hurts. And then there's visceral pain. This comes from your internal organs. It's way harder to pinpoint, and it often feels like a deep ache or a cramping sensation. This is the kind of pain you get from a stomach bug or kidney stones, and because it's so vague, it can be a real challenge to diagnose. Now, what happens when the alarm system itself is broken? That's neuropathic pain. Here, the pain isn't a response to a new injury. It's caused by damage or inflammation of the nerves themselves. And the way people describe it is totally different. They'll use words like burning, shooting, or piercing, like an electric shock. And of course, there are other important causes too. Malignant pain is specifically tied to cancer or its treatment. And then there's psychogenic pain. This is very real chronic pain that doesn't seem to have a clear physical cause. It's a powerful reminder that pain is deeply connected to our emotional and psychological state. Okay, so we've got all the pieces: location, duration, intensity, and cause. Now let's see how they all fit together to create a full, medically useful picture of what's going on. This whole systematic process we just walked through, it has a name. It's called a pain screening. It's all about using that standardized playbook to reliably and validly measure what a patient is feeling. Having this common language means every doctor is on the same page, which is the first step toward getting the right treatment. And here is the single most important takeaway from all of this. The reason this whole process is taken so seriously is because in modern medicine, pain is considered the fifth vital sign. That's right, it's ranked right up there with your body temperature, your heart rate, your breathing, and your blood pressure. It's not just a symptom, it is a core indicator of your health. So the next time you're asked to rate your pain, you'll know that number is just the beginning of the conversation. You now have the language to describe it more fully. Is it aching or is it burning? Is it in one spot or is it radiating? So I'll leave you with this. Now that you know the language of pain, how might that change the way you talk about it?